Amid a raging fourth wave of the COVID-19 cases, Delhi in the past 15 days has been hit by an unprecedented medical oxygen crisis. While several COVID-19 patients have died waiting for beds with oxygen support, the family members of at least 32 say they died inside hospitals due to oxygen shortage. The Delhi government says it continues to face oxygen shortage because of inadequate allocation and supply by the central government. But the crisis also seems to have been caused by its own failings, such as the inability to manage logistics or the absence of an allocation plan to hospitals. There is a demand-supply imbalance. Communications sent by the Delhi government to the centre showed that the city administration projected a demand for 700 metric tons per day till April 28 and revised its demand to 976 metric tons based on its bed augmentation plan on April 29. The centre, however, began to increase Delhi's quota of oxygen on a piecemeal basis from April 21, when it first raised it from 378 metric tons to 480 metric tons, then on April 30th to 490 metric tons, and then on May 1 to 590 metric tons. But the crisis is not one of demand-supply alone. From supply chain management to distribution within Delhi to better preparation to robust information exchange with citizens, experts said there were several steps the Delhi government should have taken to manage the crisis better. Officials and company representatives said that the biggest problem, the lack of cryogenic tankers, became worse because Delhi started looking for tankers only from mid-April. By then, most of the tankers available with transporters in North India were booked by states such as Madhya Pradesh, Punjab, Uttar Pradesh and Haryana. Other states had predicted that there would be a clamor to grab tankers as the demand for oxygen first grew and then spiked suddenly. Delhi kept its focus on demanding extra allocation from the centre without giving much thought about the transportation bit. Besides, the Delhi government's announcement of procuring 18 cryogenic tankers from Bangkok was also a non-starter due to technical and administrative issues. A government spokesperson said it has now sourced even tankers from the central government, apart from procuring around 5 on its own. Some industrialists and other states have also helped in providing tankers, but it is not enough. The High Court has said it is the central government's responsibility to ensure oxygen reaches Delhi's borders. A senior government official said a big challenge is to reduce the turnaround time of containers because at least 100 metric tons was being sourced from over 1,500 kilometers away. It is only over the past 2 days that Oxygen Express has been pressed to full service for Delhi to reduce the turnaround time. The centre should have done it from a week before. A central government official, however, said the railways were ready with rakes for several days, but the Delhi administration could not arrange for tankers to lift the oxygen. Delhi had no daily hospital-wise allocation for oxygen until a week ago. Earlier, the hospitals had contracts with oxygen suppliers, but this arrangement went haywire with a sudden surge in demand for oxygen. On April 22, the government decided it will start giving daily schedules of allocation to every hospital. But it was a rudimentary plan which did not work well. It was only on April 29, when the crisis was at its peak, that the Delhi government issued an order prescribing quantities of oxygen to be used by each hospital in Delhi. This order also came after the directions of the High Court. On the basis of this, now Delhi government increases and decreases the oxygen supply to different hospitals depending on the total quantum received in the city on any day. And while hospitals started sending SOS to the government from April 18, it was only on April 22 that the administration set up a helpline number with a senior IAS officer in charge of it to coordinate with all medical facilities and address their demands and grievances. Delhi does not have a verified central helpline number for people to meet their oxygen requirement or get admitted to hospitals. It has not spread awareness about phone numbers or addresses of the 14 oxygen cylinder refillers in the city, and most people are managing their individual demands through crowdsourcing on social media or by word of mouth. The Delhi government said that work on a centralized system was going on, but did not give a timeline of when it will be operational. On April 28, when scores of people were waiting outside refillers for 6 to 10 hours for oxygen, the Delhi government issued an order clarifying that people will get to refill their cylinders in Delhi only with their own ID card, the patient's ID card, and a doctor's prescription for medical oxygen. Uma Tyagi, whose 48-year-old husband died of COVID-19, said her son and daughter waited outside 2 separate refillers for 8 hours to get 1 cylinder. The State Health Department has now asked all district magistrates to deploy teams round the clock at refilling plants or retail establishments to check documents and to ensure adherence to COVID-19 appropriate behavior. T. Jacob John, former head of clinical virology at Christian Medical College, Vellore, said even if the central government failed to install PSA oxygen plants within the past 1 year, nothing stopped the Delhi government from being proactive in getting things done on its own during the entire run of the pandemic. The Delhi government has 11 hospitals under it, and the centre is installing PSA oxygen plants in 7 of them. On April 27, the Delhi government announced that the city will import 21 PSA plants from France, but that remains on paper till now, which is why the Delhi government is now looking to DRDO for more such plants. In a letter to the Union Health Ministry, the Delhi government on Sunday sought 50 oxygen generators to Delhi instead of just 4 as per the existing plan. Dr. Amit Singh, Associate Professor at Centre for Infectious Disease at Indian Institute of Science, Bangalore, said Delhi could have planned better during January-February, when cases had plummeted after the 3rd wave. Even during the 4th wave, the administration's response to this crisis was delayed on almost all aspects, putting in curbs going into lockdown, seeking the centre's help, and planning for augmentation of beds and oxygen. To be sure, several states in India are guilty of the same lapses. He said, and I quote, "We could have planned better considering all other countries had a second wave. When it comes to planning about beds, oxygen, etc., it all depends on predictions of how much the intensity of the second wave is likely to be. Because of lockdown, during the first wave, we did see as many fatalities, so we should have prepared for a 5-fold increase in intensity and calculated the percentage of people who need ventilator and oxygen support. The lockdown should have been earlier, when the positivity rate was going up."
While talking to the reporters on Wednesday, Chief Minister Arvind Kejriwal said the Delhi government will continue the lockdown based on the situation of the COVID-19 cases in Delhi. He said, and I quote, "But our only hope is that the central government will provide Delhi with its full quota of oxygen. During this tough time, we have also received massive support from the Supreme Court and the High Court. I'm hopeful that in the coming days, the situation will improve." However, looking towards the union government to alleviate problems arising from mismanagement at the local level may not be an approach the people of Delhi had hoped would come from their chief minister.